morning everyone and welcome to our panel discussion. Today we will be discussing about the sexual dysfunctions in men. Our panelists for the day are Geeta, Umama, Shweta and myself Asta. Now, before diving into this presentation, I would like to ask you all, what are sexual dysfunctions? Alright, we can learn about them together. So, sexual dysfunction is basically a problem that can happen during any phase of the sexual response cycle. So, sexual dysfunction is a problem that can lead to an individual having difficulty in the desire phase, or maybe a difficulty achieving what exactly they want during a sexual activity. It prevents you from experiencing satisfaction from sexual activity. It doesn't matter which of the individual has the dysfunction, it causes or it hampers the pleasure and it negatively affects the experience of both the partners. Sexual dysfunctions can happen in both males and females, but today we will be discussing specifically the sexual dysfunctions in men. The dysfunctions that we are going to discuss are delayed ejaculation, premature ejaculation, erectile disorder, and male hypoactive sexual desire disorder. Delayed ejaculation disorder. Delayed ejaculation is basically a condition in which a male is not able to ejaculate at time when he wants to ejaculate. Delayed ejaculation disorder refers to the persistent inability to ejaculate during intercourse. Now, I would like you to focus on the word persistent here. Delayed ejaculation is a condition that almost every man has to face at certain point in his life. Whereas, having the disorder means that it should be persistent for a certain amount of time, as it has been described, it has been referred in the DSM-5 criteria, which I will be discussing later. To make it more clearer, for example, we all have anxiety, but that doesn't mean that we all have the anxiety disorder. Similarly, delayed ejaculation, a lot of men can face, but delayed ejaculation disorder is a condition that only about 3 to 10% of men suffer from. Now, there have been various studies done on this condition. One of the most popular of those studies were done by Vince et al. In 2008. The conclusion of that study were as follows. About 85% of men who have difficulty ejaculating during intercourse can nevertheless achieve orgasm by other means, primarily through solitary masturbation. On the other hand, some men can ejaculate in the presence of a partner, but only by means of manual or oral stimulation. In some cases, men with delayed ejaculation disorder can find it impossible to ejaculate. Delayed ejaculation is a condition that almost every man experiences from time to time. I've said this before, that every man does face this condition, but that doesn't mean that they have the disorder. Delayed ejaculation is only a problem if it's ongoing or causes stress for you or your partner. Thus, for the diagnosis of delayed ejaculation disorder, the following DSM-5 criteria should be fulfilled. Criterion A. Either of the following symptoms must be experienced on almost all or all occasions of partnered sexual activity and without the individual desiring any kind of delay. The first symptom, marked delay in ejaculation. The second symptom, marked infrequency or absence of ejaculation. Now, criterion B. The symptoms in criterion A have persisted for a minimum duration of approximately 6 months. Criterion C. The symptoms in criterion A cause clinically significant distress in the individual. And finally, criterion D. The sexual dysfunction is not better explained by a non-sexual mental disorder or as a consequence of severe relationship distress or other significant stressors that is not attributed to the effects of a substance, medication or another medical condition. The physical causes of this condition: use of certain medications. Medications like antidepressants increase the level of serotonin in our body, and high levels of serotonin have been seen that can lead to delayed ejaculation. A lot of researchers have proven that. Nerve damage. Now, the damage of the nerves that control the mechanism that leads to ejaculation can delay it. This damage can be caused due to multiple sclerosis or some kind of a stroke or any kind of diabetic neuropathy, etc. Now, of course, there have been various ways we treat this disorder. Like first, medications. Medication is something that most of the doctors don't prefer, but it's still it's good because it's not a very effective way. But there's still a lot of medicines that can help you with this, like hormonal medicines like of testosterone, etc. Psychological treatments like couple therapy. Psychological in couple therapy, basically making the man comfortable to ejaculate in front of a partner, and having deal with intimacy, etc. Therapy for reduction of performance anxiety. Like giving therapy to the man, making him understand that it's not about just performance, it's about intimacy, it's about pleasure, it's about how comfortable you are in the situation, etc. Lifestyle changes like reducing the consumption of alcohol or better communication with your partner, living a healthy life, etc. can also help with solving this condition. Now I would like to call Geeta so that she can discuss about erectile disorder.
Good morning everybody. Today I'll be talking on the topic erectile disorder. So it is very common to experience or have sexual arousal or sexual desires, especially if you are in a romantic relationship. But what if even after having adequate amount of sexual excitement, sexual desire, you're not able to experience a successful sexual intercourse? Well, there might be a lot of reasons for it, but today we'll be talking about one of its causes, which is erectile disorder. So before starting, does any one of you have any idea about erectile disorder? Okay, well, I'm going to explain it. So, what is male erectile disorder? So, male erectile disorder is a condition where a man is unable to maintain or achieve an erection for successful sexual intercourse. So, earlier it was known by the term impotence, but now it is called male erectile disorder. So, I'm going to show you a video in which you can see what a man with erectile disorder experiences. They are not able to hold or maintain an erection, therefore they have a flaccid penis. It can only be diagnosed if the problems or the difficulties originate from either a psychogenic condition or a combination of psychogenic and medical factors. So there are two types of erectile disorder. The first one being lifelong erectile disorder. In this, a man with adequate amount of sexual desire or sexual excitement has never been able to achieve or maintain an erection in order to have a successful sexual intercourse or penetration. Although it is relatively a rare condition, but men across all age groups have had difficulty in obtaining or maintaining an erection. So the second type of erectile disorder is acquired or situational erectile disorder. In this, the man with sufficient sexual desire has been able to have at least one successful erection experience, but now they're unable to do so or maintain an erection for a successful sexual intercourse. So there have been a lot of studies done on this topic. A landmark study was done by Lawman et al. In 1999, in which it was found that approximately 7% of 18 to 19 years old men and 18% of 50 to 59 years old men have had erectile disorder. So, Masters and Johnsons in 1975 and Kaplan in 1987 hypothesized that erectile dysfunction is mainly due to anxiety around sexual performance. However, Barlow and colleagues argued and minimized the importance of anxiety in general, and in many cases they found out that anxiety can improve one's sexual performance. According to them, Barlow and colleagues, sexually dysfunctional men and women are preoccupied with negative thoughts or preconceptions like what if I'm unable to satisfy my partner, or what if I'm unable to hold an erection, or maybe what if my partner thinks I'm inadequate. So these are the negative negative thoughts they have, and it's not the anxiety, but in general, they focus on these negative thoughts more, which prevent them from having sexual desire or sexual arousal. So now let us talk about the DSM-5 criteria. A person should fulfill these criteria in order to be diagnosed with erectile disorder. So A, at least one of the three of the following symptoms must be experienced on almost all or occasions of sexual activity. First one, marked difficulty in obtaining an erection during sexual activity. Second, marked difficulty in maintaining an erection until the completion of the sexual activity. Third, marked decrease in erectile rigidity. B, the symptoms in the criteria A have persisted for minimum duration of approximately 6 months. C, the symptoms in the criteria A cause clinically significant distress in the individual. And finally, D, the sexual dysfunction is not better explained by a non-sexual mental disorder or as a consequence of severe relation distress or other significant stressors, and is not attributed to the effects of a substance/medication or another medical condition. Moving on, approximately 90% of the men who are on antidepressant medications experience erectile disorder, and this is one of the main causes why they stop taking these medications. And also these antidepressant medications can lead to early signs of aging. So now let us talk about the most frequent cause of older men having erectile disorder. So it can be due to vascular diseases. So vascular diseases decreases the blood flow to the penis, and they diminish the ability of the penis to hold blood to maintain an erection. Complete or permanent erectile disorder before the age of 60 is very rare.
Can you tell us about the other factors that cause erectile disorder?
Yes. Now we'll talk about the other factors that might also lead to erectile disorder. So factors like hardening of arteries, high blood pressure, diabetes, hormonal imbalances, obesity, lifestyle factors like smoking, drinking, drug abuse, not exercising regularly, eating more junk food, and also diseases that affect one's nervous system, like multiple sclerosis, can also cause erectile problems. Now let us talk about younger men. So what is one of the most frequent cause of younger men having erectile disorder? So there is a condition called as priapism. So priapism is a medical condition in which there is prolonged erection of the penis, and it doesn't diminish even after a couple of hours. So untreated cases of priapism can lead to erectile disorder. Therefore, it should be treated as a medical emergency, and it shouldn't be ignored at any cost. So it can happen across any age group, even in a newborn baby, but it mostly affects men between the age of 5 to 10 years and 20 to 50 years. So, like any other disorder, erectile disorder also has treatments, unlike the earlier times where the treatments were not really effective. For example, the cognitive behavioral treatments failed miserably, but now we have a lot of different treatments in the market. So, the first one being medications like Viagra, Cialis and Levitra. So, in 1998, a revolutionary drug was introduced in the US market called as Viagra, and it received a great amount of attention. So, Viagra works by making the nitric oxide the primary neurotransmitter involved in penile erection more available. So, Viagra is taken at least 30 to 60 minutes before any sexual activity, and erection only takes place if there is some amount of sexual excitement in the person. Okay, so there is a misconception that you can give Viagra to anybody and they'll experience an erection. No, it is not true at all, because the person needs to have some amount of sexual excitement before taking the Viagra pill. And there are a lot of other myths that revolve around the Viagra pill, and I'm going to burst few of them, like Viagra doesn't promote your libido, and Viagra doesn't improve your libido, and it doesn't improve spontaneous erections. So side effects of these medications are very uncommon and not very serious. For example, headaches, face flushing, which are only seen in 10 to 20% of the men. Provided that the person doesn't have any pre-existing heart conditions. If they do, then these medications should be provided with great caution. The other treatments include injection of smooth muscle relaxing drugs into the penile erection chambers, vacuum pump. So how does a vacuum pump works for an erection? Is basically it creates pressure around the penis, which leads to further erection. Next, in extreme cases where erection is impossible to occur, for example, due to nerve damage done during the surgery for prostate cancer, penile implants are used. You can see in these images, the extreme left image shows vacuum device, and this is the penile implant pump. So, last but not the least, lifestyle changes can also help in reducing or improving erectile disorder in a man. For example, eating a balanced diet, exercising regularly, abstaining from drinking and smoking, and abstaining oneself from illegal drug use. So in the end, I would just like to say that we as human beings have been conditioned to not talk about our personal problems, and just laugh about them. So everybody who is listening to me or watching this, I would just like to encourage them to not feel guilty talking about their problems, because if we don't, then these topics and issues won't be normalized. And yeah, so in the end, I would just encourage everybody to share their knowledge and increase awareness about these topics. Thank you. Now I would like to invite Umama to talk about premature ejaculation.
Good morning everyone. Today I am going to talk about premature ejaculation. What is premature ejaculation? It is also known as early ejaculation disorder and rapid ejaculation disorder. Premature ejaculation is the persistent and recurrent onset of orgasm and ejaculation with minimal sexual stimulation. It may occur before, on, or shortly after penetration, and before the man wants it to happen. Now, a better way to understand premature ejaculation would be through time. The average duration of time to ejaculate the time taken by a man to ejaculate who is suffering from premature ejaculation would be 15 seconds or by the 15th thrust of intercourse. Basically, we can say that the ejaculation as well as the orgasm happens within less than a minute. Whereas in sexually normal men, or when men with no sexual problem, the average time taken for ejaculation from penetration is 10 minutes. The consequences can range from failure to satisfy your partner sexually, embarrassment from ejaculating early, and disruptive anxiety about the recurrence of a similar situation in future. The DSM-5 criteria for premature ejaculation is criterion A persistent or recurrent pattern of ejaculation occurring during partnered sexual activity within approximately 1 minute following vaginal penetration and before the person wishes it. Criterion B, the symptom in criterion A must have been present for at least 6 months and must be experienced on almost all occasions of Criterion C, the symptoms in criterion A cause clinically significant distress in the individual. And criterion D, the sexual dysfunction is not better explained by a non-sexual mental disorder or as a consequence of severe relationship distress or other significant stressors and is not attributable to the effects of a substance, medication or another medical condition. Now we move on to the definition of premature ejaculation. There is no exact definition or a permanent definition to premature ejaculation. However, different people, different scholars, doctors have different criteria for it. Some say that the age of the client should be considered because doctors quite often receive complaints from younger men about about early ejaculation. Hence, the quick trigger in younger men can be considered as compared to older men. Some other scholars, other doctors believe that a lengthy period of abstinence or having a period of no sexual activity can result in premature ejaculation. However, according to the DSM-5 criteria, the diagnosis is made only when the ejaculation happens before, on, or shortly after penetration and before the man wishes it. The causes of premature ejaculation. Sexually normal men have a voluntary control over ejaculation, and this one of the reasons for it can be effective use of the technique of distraction during sexual intercourse. And men who ejaculate early are in some way not using this technique effectively. There can be different reasons for it. For example, psychological reasons like increased anxiety before sexual intercourse, sexual depression, that is the negative outlook on sexual intercourse, body image issues, relationship issues, and maybe a guilt of engaging into sexual intercourse. There can be physiological reasons or physical reasons as well, that can be increased penile sensitivity, that is the penis is very sensitive to any sexual stimuli, and a higher level of arousal upon receiving any sexual stimuli. Now, there can be a number of causes and there are a lot of explanations, but no single explanation can account for all men suffering from this problem. Hence, there is a lot of research that has to be done in this field so that we can know what other causes are there for premature ejaculation. There are different studies that have been done on this topic. One Indian study that I found is done by A.V. Ravindran, who is an MD, and Ankur Agarwal, who is an MBBS. According to this research, premature ejaculation is a very common sexual problem encountered by men in day-to-day clinical practice, and about 20 to 30% of men in the sexually active age group face this problem. And this can lead to psychological distress, loss of self-esteem, and can adversely affect the life of the patient as well as the partner. Another study that I found is by Nicholas Gilman and Michael Gilman, and they say that premature ejaculation is a highly prevalent and common male sexual dysfunction that is often neglected.
Mama, can you tell us that premature ejaculation, is it treatable?
Yes, like I said, that this is a very common sexual phenomenon. The good news is that it is also highly treatable. And now I'm going to tell you about the treatments that are available for dealing with premature ejaculation. Behavioral therapy such as pause and squeeze technique that was developed by Masters and Johnson in 1970. That was one of the most effective techniques that we have had. How does this technique work? The couple who is engaged into sexual intercourse, they are required to pause the process of intercourse and squeeze the head of the penis and allow the man the time to let go of the feelings of ejaculation and continue the process of intercourse again after the feelings are like gone. So this technique was very effective. It was 60 to 90% it was effective. However, the overall success rate was very much lower. And one of the reasons for this can be the repetitive pausing of the process of intercourse. Now, in the recent years, when more studies have been done, there's research has developed on this topic. There's a very newfound interest in pharmacological intervention. Also, men who could not receive any benefits from behavioral therapy, medication was a good option. Antidepressants such as paroxetine and mecoxetine block the serotonin reuptake and significantly allow the man to prolong the period of ejaculation. It is also important to understand that when a man with premature ejaculation is taking such medicines, it does not cure the disorder completely. The effects of the medicine stay only in the period that the medicine is taken and not after that. Thank you. And now I would like Shweta to come and talk about the final male dysfunction for today.
Good morning everyone. I'm here to talk about male hypoactive sexual desire dysfunction. Before starting, could anyone please tell me what is the meaning of the word hypoactive? Yes, so it means abnormally inactive or less active. The male hypoactive sexual desire dysfunction, which is also called as HSDD, it is closely related to ejaculatory problems or erectile dysfunction. So, in this disorder, the man has reduced interest in sex, which means that even if their partner initiates sexual activity, they have a very minimal response to it. The HSDD, it is diagnosed in men for whom this disorder is prevalent for at least 6 months, where they have distressed or impaired sexual thoughts, fantasies and desires. And along with this, the medical practitioners, they also look for the course of this dysfunction, which means they also see to it whether this has been lifelong or acquired. So in case of HSDD, you are not born with it, it is usually acquired. Acquired in the sense you get it because you are suffering from depression or anxiety or relationship issues, stress, cultural beliefs and norms. So if you have to be diagnosed with this disorder, it should be prevalent for at least 6 months and you should have distressed thoughts, sexual desires, dysfunctions. All of these should be impaired for at least the time period of 6 months.
Shweta, can you please tell us what exactly is the DSM-5 criteria for the diagnosis of this disorder?
Right. So these are the specific DSM-5 criteria for a person to be diagnosed with this specific disorder. Criteria A: persistently or recurrently deficient or absent sexual or erotic thoughts or fantasies and desire for sexual activity. The judgment of deficiency is made by the clinician taking into account the factors that affect the sexual functioning, such as age and general and cultural context of the individual's life. Criterion B: the symptoms in criterion A that I've said just now have persisted for a minimum duration of approximately 6 months. Criterion C: the symptoms in criterion A cause clinically significant distress in the individual. Criterion D: the sexual dysfunction is not better explained by a non-sexual mental disorder or a consequence of severe relationship distress or other significant stressors and is not attributed to the effects of substance, medications or another medical conditions. So a person has to fulfill all these criteria to be clinically diagnosed as someone who is suffering from male hypoactive sexual desire dysfunction. So there was a study conducted by Lawman et al. In 1999. It was in America, and the conclusions of the study were that men, when they were in the older stages of their life, which is 50 to 59 years of age,
they were 3 times more likely to suffer from the low desire compared with the men in the younger generation, which was 18 to 29 years old. So briefly coming to the causes of this dysfunction, it is generally acquired or situational rather than lifelong. Like I said, it is you typically get this disorder through the consequences in your life and you're not born with it. So these are the major causes, and it is more of psychological than physiological causes. So that's where depression and relationship stress comes, because those are the psychological causes of it. Coming to the treatment of the dysfunction, the testosterone injections have helped a lot for men who have low levels of testosterone because of HIV or hypogonadal issues. Also, the psychological factors, the underlying psychological factors such as depression, anxiety, also sexual abuse as a kid, molestation, dysfunctional families, treating all of these underlying psychological factors through therapy and mindfulness, it also helps a lot. So this was all about male hypoactive sexual desire dysfunction, and so as to conclude, I would like to say that all these dysfunctions and desires disorders, now that we have known about it, you know that it's very normal, and almost every person in their lifetime, once they go through it, even for a short period of time, they do experience this. So if someone comes up to you, says that one of your friends or family peers, anyone comes up to you and says that they are going through a tough time, you do not have to be ashamed of it. You don't have to shame them for it. It is very normal, and as someone who knows about this, who has knowledge of it, and future psychologists, it becomes your duty to let them know that you can always go out and seek help, and there are people who can legitimately help you and support you. So this was all about sexual dysfunctions in men. Thank you so much.